Over 90% of adolescents today possess at least one social media account. It is an adoption rate that has completely rewired how young people consume information and interact with their peers. This surge in engagement is largely driven by highly optimized platforms. TikTok, in particular, has seen explosive global growth among youth, dominating the daily digital diet. Parallel to this massive spike in connectivity, global healthcare systems have recorded a sharp concurrent rise in adolescent internalizing disorders, specifically depression and anxiety. This parallel trajectory seems intuitive, but it introduces a scientific problem. Despite a decade of research and thousands of published papers, the medical literature remains highly contradictory on whether these platforms actually cause psychopathology. This chart shows a PRISMA systematic review. PRISMA is a standard methodology used by researchers to evaluate the quality of scientific literature, filtering out low-quality or anecdotal studies. Here at the top, we see the initial sweep, capturing 326 potentially relevant records. But as we move down the diagram, hundreds of papers are excluded due to poor methodology, lack of control groups, or insufficient data. Out of those hundreds of initial records, only 11 highly rigorous articles were ultimately selected for the core analysis. Even within this highly refined data, the correlation between the raw number of hours spent online and adolescent depression remains weak. If raw duration were the primary driver of illness, these datasets should show a much more robust correlation than the 0.1 to 0.15 coefficients typically reported. This suggests that the standard way we measure digital exposure, total hours, may be missing the actual mechanism of harm. The medical community has long relied on a variable known as screen time. This is a metric that conceptually bundles vastly different behaviors into a single, generic predictor of mental health. When a researcher combines an hour of researching a homework assignment with an hour of watching self-harm content into the exact same data point, it mathematically degrades the empirical accuracy of the study. The limits of this traditional metric become obvious when you weigh an hour of active, supportive peer connection against an hour of passive, algorithmic scrolling. The psychological impacts of these two activities are entirely different, yet screen time records them identically. To accurately predict digital psychopathology, researchers have to move past generic duration metrics. The risk-to-benefit ratio of an adolescent's digital life is dictated by two specific vectors: the displacement of offline activities and the behavioral valency of the interaction itself. The first vector is the displacement hypothesis. This argues that the harm of social media comes directly from the physical world activities it replaces. To understand how this displacement occurs, we look to psychologist Roy Baumeister's theory of ego depletion. Ego depletion is the psychological concept that self-control is a finite mental resource that can be exhausted. As a user cycles through endless, stimulating content loops, this cognitive battery drains, leaving them vulnerable to impulsive behaviors. In this depleted state, adolescents are less likely to engage in the restorative, in-person social interactions clinically proven to protect against mental illness. The most critical biological activity displaced by digital technology is sleep architecture. A comprehensive 2016 meta-analysis by Carter and colleagues examined the specific impact of mobile device usage on adolescent rest. They found that roughly 40% of adolescents report using mobile devices within 5 minutes of going to bed. The physiological consequences of this displacement are severe. It leads to inadequate sleep quantity, degraded sleep quality, and chronic daytime drowsiness. In the context of the displacement hypothesis, the screen itself is not the direct cause of the mental health decline. The severe disruption of circadian rhythms and offline emotional development is what damages the patient. The second mechanism of harm is behavioral valency. This framework separates digital interactions into active and passive categories. Active use involves goal-oriented communication, such as direct messaging a friend, collaborative gaming, or creative expression. As users scroll, they are forced into constant upward social comparison and excessive reassurance seeking against highly curated realities. The passive scrolling feeds directly into upward comparison, which then outputs clinical symptoms of depression and anxiety. Research by Farduli and Vartinian demonstrates how this specific pathway drives severe body image concerns and the onset of eating disorders. Furthermore, the data shows that this passive valency vector is statistically more robust and significantly more damaging for adolescent females than for males. The algorithm's delivery of curated lives acts as a pathogen. The quality of the digital session is more dangerous than its total length. Yet the data also contains a strong positive countersignal. Social media frequently acts as a protective, therapeutic platform that provides vital social support. For socially isolated youth, finding a digital community actively prevents the deterioration of their mental health by fostering healthy peer connections they cannot find locally. This duality persists because the field relies almost exclusively on self-reported survey data. Studies show that self-reported estimates of digital behavior have a weak correlation with objectively verified digital logs. When researchers compare what teenagers say they do against the actual usage tracked by background health and activity applications on their smartphones, the numbers rarely match. Building correlative models based on flawed human memory will fail to establish true clinical causality. This diagnostic framework replaces screen time. The y-axis is offline displacement. The x-axis is behavior valency. The upper left quadrant is high risk, showing severe sleep displacement and passive upward comparison. The lower right is low risk, showing minimal offline displacement and active goal-oriented peer connection. Mathematically, two patients with identical screen time totals can have completely opposite risk profiles. Because adolescents use these tools with specific intent, clinical focus must move from counting hours to analyzing behavioral patterns. Recent scoping reviews conclude that cross-sectional data and one-off surveys can no longer provide new insights into clinical causation. The field must pivot to longitudinal studies. By utilizing objective background device logging over extended periods, researchers can establish definitive cause and effect. There is also potential for digital psychiatric screening. Advanced machine learning models are being developed to detect early linguistic and behavioral markers of depression directly from social media data. Clinicians, researchers, and parents must treat adolescent digital behavior as a complex psychosocial stressor. We have to diagnose the specific nature of the interaction rather than simply watching the clock.